Yes, good evening, everyone. This is Dr. Abhijeet, and today I will be discussing about the blood supply of the gut. I will be discussing or focusing my discussion on the blood supply of the gut. I hope the audio visuals are very much clear to each and everyone over here. So, before without wasting much more time, let us just start with the blood supply of the gut, right? So, yes, just a moment. I'm just checking the connections. I hope it's perfectly fine. Sure. Let's start with the class. I hope everyone is like present enough. So, without wasting much more time, I will be discussing the blood supply of the gut. So, yeah, this all I have discussed previously. So, let's start from the abdominal aorta, guys, everyone. Let's start from the abdominal aorta. See, abdominal aorta, the basics that you should know. You already know we have something which is called as the left atrium, and from the left atrium, basically what comes, it is the left ventricle, and from the left ventricle, we have something which is called as the aorta. We have something which is called as the aorta. So you all are aware that you all are aware of the fact that this iota gives three branches, okay, the direct branches. Now this iota is descending downwards. Now this iota is descending downwards, and basically, um, the region in which it is descending, it is the thorax region. So this iota is named as thoracic aorta. This iota, it is named as the thoracic aorta, and apparently, it continues below the level of diaphragm. It continues below the level of diaphragm as abdominal aorta. As abdominal aorta. Now, whenever I am teaching arteries or like any part or any organ, or if I'm just discussing the blood supply, I'm always taking you guys to the left ventricle. The only reason is whenever I am asking you ki this particular artery is a branch of, you guys don't remember. Don't ratify anything, guys. Basically, discuss it from the basics, from like wherever we are just going through. So I will say abdominal aorta is coming from the thoracic aorta. The thoracic aorta is coming from the arch of aorta coming from the left ventricle. Our discussion will be focused on the abdominal aorta right now because it is the main arterial supply of the gut. Okay, so I will be focusing on the abdominal aorta as of now. And all the diagrams that I will be drawing with you, I would request each and everyone to focus and just learn along with me. So, yes, now my main point of discussion will be this abdominal aorta because it is the main aorta that is supplying the gut. Okay, it is the main aorta that is supplying the gut. Now, to discuss the abdominal aorta, guys, first I will do over here today. I will be first discussing the handmade diagrams, the line diagrams. Then comparatively, I will show you the pictures. Okay, the atlas pictures, which will be like helpful to you as well, because in the upcoming exams, I hope these atlas pictures are going to be there. And so, what I'm gonna discuss with you right now today. Okay, and let us start with firstly a line diagram. Not so fancy diagrams. I'll be just focusing on the line diagrams right now. So yes. Now, abdominal aorta, basically, it comes from the diaphragmatic opening between the left crus and the right crus of the abdomen. Okay, we have two crus of the abdomen, the left crus. Okay, so this is the left crus of the diaphragm. Okay, and this is anatomically it is the right crus of the diaphragm. right crus of the diaphragm. So the diaphragm has the left crus and the right crus. Okay. So the abdominal aorta basically it comes from the diaphragmatic opening. It comes from the diaphragmatic opening between the right and the left crus of the diaphragm. Okay, between the right and the left crus of the diaphragm. So there is an opening in the diaphragm which is located between the right and the left crus, and from here we have our very important that is called as the abdominal aorta. All the things which I will be marking, they are very important, guys. They are very important. Now, this abdominal aorta will branch also. Okay, this abdominal aorta will branch. So, yeah, I will be discussing the branches of the abdominal aorta. So, kindly don't worry, and I will be showing you the pictures on the atlas as well. Okay, so now, guys, let us start with the anterior branches of the abdominal aorta. Now, this is the abdominal aorta, which is actually a part of the thoracic. I mean, it is continuing as abdominal aorta in the abdomen, just below the diaphragm, and above the diaphragm, it is the thoracic aorta. It is coming from the arch of aorta from the left ventricle. Now, this abdominal aorta has three anterior. Now, when I say anterior, anterior का मतलब है बेटा आगे की तरफ. अब ये abdominal aorta जो है आगे की तरफ branches देगी. Okay? It will give branches in front. Okay, or it is also called as the visceral branches because it is supplying to the organs of the abdomen. Okay, so we have the three abdominal I mean anterior or the visceral branches. The very first branch beta that you have to discuss, it is the celiac trunk. Okay, ये आगे की तरफ से I'm just showing you by a simple circle. Okay, so this particular, it is the celiac trunk. It is celiac trunk. Try to draw the diagram with me because it will be very helpful in like understanding the pictures from the atlas as well. Now the celiac trunk basically arises from the lower border of T12. Okay, so it arises from the lower, means it is at the level of, I would say it is at the level of lower border of T12 vertebrae, thoracic 12 vertebra. So it is one of the branches. Okay, now second branch beta, remember it is the superior mesenteric artery. Okay, it is the superior mesenteric artery. It is the superior mesenteric artery. Now, superior mesenteric artery, it is at the level of lower border of lumbar 1 vertebra. So, it is at the level of lower border of L1 vertebra. Okay, it is at the level of lower border of L1 vertebra, and one anterior branch more we have. Okay, so yeah, I'll just draw it a little above so that I have more space over here. Yeah. And this is the inferior mesenteric artery, and it is the inferior mesenteric artery. Inferior mesenteric artery. Okay, it is at the body of L3, at the body of L3 vertebra. अब आपको भी पता है वी हैव thoracic vertebra, lumbar vertebra, उसी के लेवल पर I mean, at the body of the L3 vertebra, inferior mesenteric artery originates from the abdominal aorta. So ideally, we have three branches right now. We have three branches right now. The anterior or the visceral branches. We will just write it in our notes as well. Whatever I'm just drawing in the picture. So you should know the branches as well. So remember that we have three anterior or visceral branches. Side by side, just write it down, beta, because it will like complete up your notes as well. So you can very well see that this branch is there, that is the celiac trunk. Okay, then we have the superior mesenteric artery, and then we have the inferior mesenteric artery. I'm just showing you the parallel picture from the atlas, right? So we have the three branches which are coming in front, that's why they are anterior. And why we are calling them visceral? Because they are supplying the organs, okay, of the gut, right? So I will be discussing each branch in detail, the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery in detail. So kindly don't worry up for this. So the three anterior branches, the first one, it is the celiac trunk. The second one, remember, it is the superior mesenteric artery. The third one, it is the inferior mesenteric artery. Inferior mesenteric artery. So yes, eventually you should remember, right, that the celiac trunk will supply the foregut, the foregut. The superior mesenteric artery will supply the midgut. The inferior mesenteric artery will supply the hindgut. So I will be discussing each of these branches in detail. Okay. Now before that, let's continue the diagram on, or the line diagram on the abdominal aorta. So we have three anterior branches. Now coming on to the five lateral branches. Now five lateral branches. Okay. Or I would simply say the abdominal wall branches. Okay. The abdominal wall branches. Now, when I say abdominal wall, you already know the abdominal wall. It is made up of the roof, the floor, the anterior abdominal wall, and the posterior abdominal wall. I'm not talking about the cavity right now, guys. I'm just talking about the walls. Okay, it is just like a room. We have the roof, we have the floor, we have something in front and something at back. The anterior abdominal wall, the posterior abdominal wall, the roof, and the floor. So it is just like this. So remember, the abdominal wall branches, basically you should remember that there is one artery which is coming directly from the abdominal aorta, and it is supplying the diaphragm and the lower end of the esophagus. Okay, it is supplying the diaphragm and the lower end of the esophagus. Now these arteries are bilateral, I mean, it right side bhi hai, left side bhi hai. And remember the name of this artery that I have drawn just right now, guys. This artery, it is the inferior phrenic artery. Inferior phrenic artery. Inferior phrenic artery. Inferior phrenic artery. Now phrenic मतलब ही diaphragm है, तो ये diaphragm को सप्लाई करेगी, प्लस इट विल ऑल्सो सप्लाई द लोअर एंड ऑफ द इसोफेगस. तो ये शॉर्ट में यहाँ पे आपको लिख लेना है कि this inferior phrenic artery, it supplies the diaphragm, it supplies the diaphragm plus lower end of esophagus. लोअर एंड ऑफ इसोफेगस. तो एक लेटरल एब्डोमिनल वॉल की तो ब्रांच होगी, क्योंकि डायफ्राम ही इसका क्या बनाता है, रूफ बनाता है, और रूफ वॉल का ही हिस्सा है, ठीक है. तो और दूसरी जो इसकी ब्रांचेस हैं, that are supplying the lumbar part, the lumbar vertebra. Okay, so yes, they are supplying the lumbar vertebra Ultimately, the branches will be like this. We have four lumbar branches. We have the four lumbar branches, and these four are basically, you should remember, these are the lumbar arteries. Okay, so these are also bilateral, right? So we have right and left side, both are there. So we have the lumbar arteries. So remember, so let's complete the notes. So we have the five lateral. Okay, we have the five lateral, or I would say the abdominal wall. Now I'm just talking about the wall, guys. I'm not talking about the internal organs. Okay, it is just the wall. The diaphragm is the superior wall of the abdomen, right? It is on the top. So five lateral abdominal wall branches. And remember, out of this, we have the inferior phrenic arteries, right? Inferior phrenic arteries. And remember that inferior phrenic arteries are basically the first branch of abdominal aorta. It is the first branch of abdominal aorta. Another important question. Okay. And the second one that you have to remember over here, it is the four lumbar arteries on each side. Four lumbar arteries. So in total, we have five on one side. Comparatively, these are 10 arteries, right? So remember, we have the lateral wall branches that I have drawn with the orange color, the lumbar arteries, and the inferior phrenic artery, which is supplying the diaphragm, plus the lower end of the esophagus as well. The lower end of the esophagus as well. Okay. Now, guys, remember, we have three lateral visceral branches. Three lateral visceral branches now. Okay. We already know we have a structure in the human body, that is the organ in the human body, that is called as the kidney, right? So we have the kidneys as well. Okay, we have kidneys. Okay, so the kidneys are getting direct blood supply from the aorta, and these direct blood supply are directly from the aorta. Now I'm talking about the lateral branch only. But now, guys, these are not wall branches. These are supplying the organ, the viscera of the abdomen. Okay, the internal part of the abdomen. And you already know the kidney is the internal organ, right? Kidney is an organ. These are lateral only, but they are supplying the visceral part, okay, the organal part of the abdominal cavity. So this is something which is called as the renal artery, right? So this is something that is called as the renal artery. So remember that the renal artery, okay? Remember the renal artery. Now, two branches are coming directly, okay? Like this. I will just use another pen over here. Okay. One branch, okay? Now, these two branches which I have drawn right now, guys, these are gonadal arteries. These are gonadal arteries, okay? So this is, you should know that this is the gonadal artery. When I say gonadal artery, you should directly remember that these are supplying the gonads. Okay, so it is apparently the testicular artery and the ovarian artery. Okay, so gonadal artery, it is the testicular artery, or it is also, like in females, it will be the ovarian artery that are getting direct branch from the aorta. So we have gonadal arteries, the renal arteries, and one more branch is there. Okay, one more branch is there, guys. So you all are aware that we have something which is called as the renal glands. I mean, the suprarenal glands. Okay, so yes, the adrenal glands. So yeah, I'm just trying to draw the suprarenal glands that are located just above the kidney. The suprarenal glands, the suprarenal glands that are located just above the kidneys, and the suprarenal gland, the middle part of the suprarenal gland, it is getting direct supply from the aorta, the lateral branch, and this is what we call it as the middle. Yeah, yes, it is the middle suprarenal artery. So I'll just write it over here, the name of the artery. It is the middle suprarenal artery. Okay, MSA. Okay, the middle suprarenal artery, the renal artery, and the gonadal artery, which are supplying the testes in males and ovaries in females. So remember that we have now the third part, the third abdominal aorta branches, that is the three lateral visceral branches. Three lateral visceral branches. Now when I say visceral, बेटा visceral का मतलब होता है organs. ठीक है, पहली वाली जो थी वो डायफ्राम को सप्लाई कर रही है, और डायफ्राम इज नॉट एन ऑर्गन फॉर द एब्डोमेन, राइट, इट इज जस्ट फॉर्मिंग द सुपीरियर वॉल. ओके, वॉल की बात कर रहे हैं, और लुम्बार भी पीछे की तरफ है, तो ये पीछे का पोस्टीरियर एब्डोमिनल वॉल बनाता है. In the earlier lectures on abdomen, I have already discussed that diaphragm forms the superior wall, and the posterior abdominal wall is formed by the lumbar arteries along, I mean, the lumbar vertebrae along with the back muscles, right? I mean, the posterior abdominal wall muscles, the psoas major, psoas minor, quadratus, iliacus. Okay, so these both are lateral only. One, it is supplying the abdominal wall, the other, it is supplying the organs. And now which organs I have already discussed? Okay, I have already discussed the renal artery. The renal artery, it is getting the direct branch from the abdominal aorta, the renal artery. Apart from that, we have middle suprarenal artery, the middle suprarenal artery, and the third one, it is the gonadal arteries. Gonadal arteries, it is testicular in males, and in females we call it as ovarian artery. The ovarian arteries. Yes. I hope this point is now clear to you. So by far we have discussed that the anterior branches which are coming in front, the lateral branches which is supplying the walls, and the lateral branches which are supplying the organs. So we have discussed the gonadal, renal, and middle suprarenal arteries. So the middle suprarenal arteries, the renal artery, and the gonadal artery are supplying the organs, right? The testes, ovaries, the kidneys, and the glands. So these are the viscera of the abdomen. So yeah, they are getting the direct blood supply from the aorta itself, right? Apart from that, guys, I wanted to have a clear discussion now over here. Now, this suprarenal gland, which I have drawn with blue color, okay, the adrenal glands, which I have drawn with blue color, right? It is getting in between the middle part of it, it is getting the direct blood supply. But what about the superior and the inferior part of this renal gland? I mean, the suprarenal gland, okay, the adrenal gland. Kidneys के ऊपर है तो इसलिए इसको नाम क्या बोलते हैं? Suprarenal glands. Okay. Now, you should remember they are not coming from the iota. So that's why I will be just focusing you over here. The superior part of this suprarenal gland or the adrenal gland, it is getting a direct blood supply from the phrenic artery. Okay, the phrenic artery that I have drawn with red color, that is the superior suprarenal artery, SSA. And the inferior part of this, what I would say, the एड्रीनल ग्लैंड्स और द सुप्रा रीनल ग्लैंड, देखो किडनी के ऊपर है तो इसलिए इसको हम सुप्रा रीनल ग्लैंड्स बोलते हैं, ठीक है। एड्रीनल ग्लैंड्स है। एड्रीनल ग्लैंड्स के तीन पार्ट्स है, सुपीरियर, मिडल और इन्फीरियर। मिडल वाली जो ब्रांच है वो डायरेक्ट आयोटा से आती है, दैट इज द लेटरल ब्रांच। बट जो ऊपर वाली ब्रांच है, जो सुपीरियर वाली ब्रांच है बेटा, वो इन्फीरियर फ्रेनिक आर्टरी से आ रही है। वो इन्फीरियर फ्रेनिक आर्टरी से आ रही है, इसलिए आर्टरी का नाम क्या है? सुपीरियर सुप्रा रीनल आर्टरी। And superior suprarenal artery is coming from inferior phrenic artery, okay. And the inferior phrenic artery, it is coming from the inferior phrenic artery, it is coming from the renal artery, वो डायरेक्ट नहीं आ रहा है aorta से, it is coming from the renal artery, so it is the inferior suprarenal artery, okay, inferior suprarenal artery. So you should remember that SSA, basically it stands for the supra, or firstly the superior suprarenal artery, superior suprarenal artery, and remember it comes from phrenic artery, okay. It comes from inferior phrenic artery, inferior phrenic artery. Now if we talk about ISA, that is the inferior suprarenal artery, it is coming from the renal artery, it is coming from the renal artery. So that concept should be clear कि हाँ, किडनी के ऊपर एक ग्लैंड होता है, that is the adrenal gland और the suprarenal gland. Suprarenal gland के भी तीन पार्ट, superior, middle और inferior. मिडल वाली जो है, middle वाली जो है, I have already told you the middle suprarenal artery, it is coming directly from the aorta, right? But the superior suprarenal, it is coming from the inferior phrenic, and the inferior suprarenal artery, it is coming from the renal artery. So superior suprarenal and the inferior suprarenal, they are not direct branches. They are coming from inferior phrenic and the renal artery respectively. They are coming from the inferior phrenic and this. So I hope this is clear up till now. I hope this is clear as of now. Now, apart from that, guys, so if you have just written this, let us now focus. Let us now focus that there is one more branch, okay, that arises posteriorly from the mid of the aorta. ये एक तो aorta के बिल्कुल पीछे से आ रही है और बिल्कुल middle से आ रही है, okay. For drawing purpose, I'll just erase this. I hope you guys have written this. Yeah, I hope you just have written this. So just to make my diagram look more good, yeah, I'm just erasing this. So I've just explained you about this as well. Now, yeah, okay. So this branch, it is coming posteriorly. Okay, this is coming posteriorly, and remember the name of this branch. Okay, it arises from the back surface of aorta. So this is what is called as the median sacral artery. Okay, it is called as the median sacral artery. Sacral artery. The median sacral artery. Now, guys, let us pen down this in our notes as well. You should remember that we have one posterior branch. It is coming from the dorsal surface of the aorta. Aorta के पीछे से आ रही है बेटा. If you can just figure it out, ये देखो बिल्कुल sacrum की तरफ pass कर रही है. This one. If you can just figure it out, guys, this is arising from the back surface of the aorta. That one I'm highlighting over here in the picture. Okay, that is the median sacral artery, guys. That is the median sacral artery that is coming from the back surface of the aorta. So remember, it is the posterior branch and it is the median sacral artery. Median sacral artery. and it is arising from the back surface, तो इसलिए हम posterior branch बोलेंगे. Lateral दो तरह की, एक तो abdominal wall और एक organ को supply करने वाली, आगे वाली भी हो गई, पीछे वाली भी हो गई. अब आ जाते हैं last and the least one, that is, but not the least one, that is the terminal branches. The terminal branches of this. So remember that this, what we can say, the abdominal aorta basically bifurcates into two parts, and this is something which is called as the common iliac arteries. It is called as the common iliac arteries, right? It is the common iliac arteries, the right common iliac artery, and the left common iliac artery, vice versa. Now, the right common iliac artery, okay? Now, the aorta basically divides into two parts, okay, the right common iliac artery and the left common iliac artery, and it is all occurring at the lower border of the L4, okay, it is all occurring at the lower border of L4, lower border of L4 vertebra, okay, the lumbar vertebra 4, it is basically dividing over here, okay. So yes, it is the lower border of L4 vertebra, okay, in which the aorta bifurcates into the right common iliac artery and the left common iliac arteries. And remember, at at the lower border of L5, the common iliac arteries will again like divide into external iliac artery and internal iliac artery. So this is external iliac. अच्छा हाँ, जस्ट अ मोमेंट, ये मैंने राइट लेफ्ट उल्टा लिख दिया है. तनुप्रिया, थैंक यू फॉर नो करेक्टिंग इट. इट इज द लेफ्ट कॉमन iliac artery and the right common iliac arteries. Yes. So lower border of L5, it will divide into the external iliac artery, and this one, guys, it is the internal iliac artery. Internal iliac artery. तो इन टर्न यू शुड रिमेंबर द टर्मिनल ब्रांच. टर्मिनल का मतलब है जहां पर वो खत्म हो रहा है एब्डोमिनल आयोटा. एब्डोमिनल आयोटा लोअर बॉर्डर ऑफ L4 पर बाइफिकेट कर जाता है किसमें, कॉमन इलियाक आर्टरीज में. लेफ्ट कॉमन इलियाक आर्टरी हो गई और राइट कॉमन इलियाक आर्टरी हो गई, ठीक है. अब लोअर बॉर्डर ऑफ L5 पर आकर ये कॉमन इलियाक भी बाइफिकेट कर जाता है किसमें, एक्सटर्नल इलियाक आर्टरी और इंटरनल इलियाक आर्टरी में. तो ऑब्वियसली बात है ये राइट कॉमन इलियाक आर्टरीज हो गई, ठीक है. और ये वाली क्या हो जाएगी, एक्सटर्नल इलियाक आर्टरी, और ये अंदर वाली क्या हो जाएगी, इंटरनल इलियाक आर्टरीज. इंटरनल इलियाक आर्टरीज. So now it's almost clear that this is the diagram for the abdominal aorta, which I have tried to make it very simple. Which I have tried to make it very simple right now. Yeah, I have just tried to make it very simple for you guys. So we'll just write the terminal branches also. So okay, now just we'll add one more slide and we'll finalize the terminal branches also. So we have already discussed the four branches. The fifth part that you all have to write right now, it is the terminal branches. The terminal branches, and remember, at the lower border of L4 vertebra, at the lower border of L4 vertebra, the aorta will divide. The abdominal aorta divides into right common iliac artery, and the left common iliac artery, Now, you already know that at the lower border of L5, lower border of L5, it will again divide into, we have the iliac artery, internal iliac artery, and the external iliac artery. So you should remember this whole picture. This whole picture should be like on tips, guys, right? So you can very well see, guys, if I just ask you that it is bifurcating, right? It is bifurcating, and this is the common iliac artery. And common iliac artery of which side? It is the left side. So it is the left common iliac artery, and this one, it is the right common iliac artery, right? And this common iliac artery, it is also bifurcating into internal, or I'll just use another pen, internal iliac artery एंड एक्सटर्नल iliac artery. ये ग्रेस एनाटमी की पिक्चर है, देखो कितना सही से बनाया हुआ है. तो सीलियाक ट्रंक हो गया, सुपीरियर मेसेंट्रिक आर्टरी हो गई, इंफीरियर मेसेंट्रिक आर्टरी बना दी. तो ये तो आगे की तरफ आ गए ब्रांचेस. टर्मिनल ब्रांच में कॉमन iliac arteries which again bifurcate into external iliac and internal iliac. लेटरल ब्रांचेस में आप देख सकते हो किडनी की तरफ जा रहा है एक ब्रांच. यस, एंड दिस इज द middle the renal arteries, right? The renal arteries, obviously. Okay, one which is going above, it is the phrenic arteries which are going above. So yes, that's a very simple the complex diagram that I have like made it very simple in this form, so that you can just go through it. So that's winds up the abdominal aorta right now. Okay, so yeah, this much you should know about the abdominal aorta. I hope it is clear to each and everyone over here. If anyone is watching, just give me a thumbs up that you all are like clear with the fact over here. I mean, whatever we have just discussed. If anyone is watching, just let me know. So this is the abdominal aorta, and I will be focusing my discussion right now on the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery and their branches with very simple diagrams. And I will compare the diagrams with the diagrams which are given in the atlas. And that is something which is very asked. Okay, Tanupriya, very good. Okay, okay, perfect, guys, perfect. Okay, sure. Now, abdominal aorta is anyhow done. So let us now focus. So that is a very simple picture that I have just tried to show you guys. Okay, the celiac trunk, which you can very well see, the superior mesenteric artery and the inferior mesenteric artery, the anterior branches, and the like the posterior. It is rising from the posterior part of the aorta, that is the sacral artery. It is going above, means in front of the sacrum. Okay, the sacral vertebra. That's why it is named as the sacral artery, and median because it is coming from the midline, and though it is coming from the posterior part. Okay, so you can see these are all branches from the front of the abdominal aorta, right? And we already know the right and the left gonadal arteries that I have already discussed. Okay, that I have already discussed. Okay, phrenic arteries. Okay, middle suprarenal arteries are direct from the aorta, but the superior suprarenal, it is coming from the phrenic, inferior phrenic artery, and the inferior suprarenal, it is coming from the renal artery, right? So that is a simple um, picture to show what I have just discussed in the given image. Okay, I have just made this image for you people over here. So yes, now let us focus our discussion on celiac trunk. Celiac trunk. Now celiac trunk. Now this is something that we have to discuss in detail. So this diagram, before coming to the diagram which is given in the atlas, let us first try to make it simplify, or I'll just simplify for you guys by drawing a handmade diagram in front of you. Okay, so try to understand this particular concept okay at once, so that it's like comparatively easy for you guys to know. So remember guys, we have the lesser curvature of the stomach. Okay, the lesser curvature of the stomach, the greater curvature, and it will continue as the duodenum. And yeah, it will continue as the duodenum. So remember that the celiac trunk, it is the artery of the foregut. So you should remember that the celiac trunk. Now I'm asking you, celiac trunk is a branch of abdominal aorta. Abdominal aorta का भी कौन सा branch है? Ventral branch. Ventral का मतलब होता है आगे, anterior branch of abdominal aorta, right? So this is the celiac trunk. Okay, I'm just writing in short form, that is CT over here. I will be using the short form in the picture to make the diagram look more nice. Otherwise, it is a very complex diagram. Okay, so it is the artery of foregut that you should remember. It is the artery of foregut. It is the artery of the foregut. And remember, when I say foregut, it is basically the stomach, which will get its supply from the celiac trunk. Okay, the upper half of the duodenum till the duodenal papillae. It is the upper half of the duodenum, the liver, the spleen, and the pancreas. So if I ask you that celiac trunk, it is giving supply to which organs? So you should remember that it is giving supply to the stomach, the upper half of the duodenum till the duodenal papillae, the liver, the spleen, and the pancreas. The liver, the spleen, and the pancreas, guys. The liver, the spleen, and the pancreas. Yes. Now, guys. Okay. Let us suppose that this is the celiac trunk that I'm just showing right now. Okay. It is the celiac trunk, and I'm just writing it very shortly. CT. It simply means the celiac trunk, which is coming from the abdominal aorta. Now, the celiac trunk will give a tortuous branch, tortuous artery, and it will pass behind the stomach. That's why I'm drawing it dotted. Beta जो भी चीज dotted draw करूं, remember that it is going I mean it is posterior, dorsal. ये stomach के पीछे से जा रही है. Okay, and this tortuous branch, okay, this artery which is arising directly from the celiac trunk, it is the splenic artery, guys. It is the splenic artery. Splenic artery. Now the splenic artery is arising from the celiac trunk. Okay, it is arising from the celiac trunk and it is passing behind the stomach. It is passing behind the stomach, and since it is splenic, so obviously it will go to a very important organ of the body, that is the spleen. Okay, that is the spleen, and when it reaches the spleen, guys, it will give 5 to 7 branches. 5 to 7 branches. It will divide into 5 to 7 branches, and it will be like, okay, when it will reach the spleen, it will divide into 5 to 7 branches, and these are called as the hilar branches. These are called as the hilar branches, and remember, they are reaching one organ, and that organ, it is the spleen. Okay, so remember that this organ, it is the spleen, and the spleen is getting a direct supply from the celiac trunk, that is in the form of splenic artery, which is further dividing it into 5 to 7 branches. And remember that these branches are basically called as the hilar branches. Hilar branches or hilar branches. Now these hilar branches are basically 5 to 7 in number. It can vary from person to person. It is usually 5 to 7 in number. It is 5 to 7 in number. Hilar branches. So one, I would say the branches of the celiac trunk now, guys. Already we have discussed the abdominal aorta, right? We have discussed the abdominal aorta, and yeah, the Abdominal aorta, we are discussing the celiac trunk right now. Okay, we are discussing the celiac trunk. So now my question is why it is a tortuous artery. Okay, now why it is a tortuous artery. ये twisted arteries जैसी लग रही है ना, tortuous artery. Why it is tortuous in nature guys? Because जब भी कहते हैं ना कि अगर stomach move करेगा तो spleen will also move along with the stomach. ठीक है, and that's why to increase the length, that's why it is tortuous in nature. Okay, that's why it is tortuous in nature. So that's why guys it is the tortuous artery. It is the tortuous artery because whenever the it whenever the stomach will move, or the along with the stomach the spleen we move, we actually need some extra length from the splenic artery, and just to so that the blood supply is not hampered. That's why it is tortuous in nature. Okay, that's why it is like tortuous artery. So splenic artery is a tortuous artery, make it tortuous guys. Okay, now since I have discussed it in the previous video also, but this is an updated version because I will be discussing more branches over here, more branches in this video. Now this splenic artery, okay, this splenic artery, after giving supply to the spleen guys, after giving hilar branches to the spleen, this splenic artery will give some branches, and it will supply the fundus of the stomach. Okay? It will supply the fundus of the stomach, and this artery it is called as the short gastric arteries. Okay, these are called as the short gastric arteries. So I will be writing it with black so that you are aware that these are the short gastric arteries. Short gastric arteries. So if I ask you, short gastric arteries are basically arising from what? It is arising from the splenic arteries. Okay, so it is actually supplying the fundus of the stomach. Okay, it supplies the fundus of the stomach. I don't have space over here, otherwise you should write that it supplies the fundus of the stomach. Short gastric arteries. I will. It supplies the fundus of stomach. Supplies fundus of stomach. The short gastric arteries. It will give one more branch guys. It will give one more branch that will be towards the greater curvature, and this branch is towards the greater curvature of the stomach, and this is something which is called as the left gastroepiploic artery. It is called as the left gastroepiploic artery. नाउ गाइस व्हाई इट इज एपिप्लोइक. एपिप्लोइक वर्ड जब मैं डिस्कस करूंगा ना कि लेसर सैक और ग्रेटर सैक ऑफ स्टमक, जो लिवर से कनेक्ट करता है और स्टमक को नीचे से, तो जब मैं उस चीज का डिस्कशन करूंगा तब मैं तुम्हें बताऊंगा एक पेरिटोनियल फोल्ड्स होते हैं. ठीक है, ग्रेटर ओमेंटम. तो दैट्स व्हाई वो जो एपिप्लोइक फोरामेन होता है उसकी वजह से इसको नाम दिया गया. इट इज कमिंग फ्रॉम दैट ओनली. सो दैट्स द रीजन व्हाई इट इज गिवन एज द नेम ऑफ एज लेफ्ट गैस्ट्रो एपिप्लोइक आर्टरी. अभी के लिए याद रखो, जब मैं पूरा पेरिटोनियम और ओमेंटम डिस्कस करूंगा देन वी विल लाइक फोकस more on that as well. Okay, so it is giving one more branch, that is the left gastroepiploic artery. तो अभी मैंने सिर्फ इतना बताया कि splenic artery होती है, tortuous है, it is giving hilar branches 5 to 7 that supplies the spleen. Apart from that, it is supplying the fundus of the stomach in form of short gastric arteries, and giving one more branch that is supplying the greater curvature of stomach, that is in the form of left gastroepiploic artery. Left gastroepiploic artery. Now, remember, guys, there is another branch from the celiac trunk, a direct branch from the celiac trunk. Okay, that is supplying the stomach. Okay, the lesser part of the stomach, the lesser curvature of the stomach, and it is called as the left gastric artery. It is called as the left gastric artery. Now, till now, I have shown you two branches direct from the celiac trunk, the splenic artery and the left gastric artery. Now, the left gastric artery will give one more branch, okay, will give one more branch, and this branch will supply the lower end of the esophagus, okay, it will supply the lower part of the esophagus, and this is something which is the esophageal branches, okay, this is the esophageal branches, esophageal branches, esophageal branches. तो ये शॉर्ट गैस्ट्रिक वाला पॉइंट मैं इरेज कर रहा हूँ, तो आई डोंट लाइक my diagram to go messy, but yeah, I hope you have written it. So just mention that we have a left gastric artery which is coming directly from the celiac trunk, and it is giving one branch above, and it is supplying the lower part of the esophagus, that is the lower esophageal branches, lower esophageal branches. So till now we have discussed the two branches over here. Now to complete my diagram, I will draw one more structure over here, guys. One more structure over here, and that is our famous liver. Liver. So this is the liver, guys. This is the liver that I have drawn in front of you right now. And now there is one more branch that will be coming from the celiac trunk. That will be coming from the celiac trunk. And remember that this branch, okay, it is called as the common hepatic artery. This branch, it is called as the common hepatic artery. This is the common hepatic artery. Common hepatic artery. कॉमन हेपेटिक आर्टरी. तो सीलियक ट्रंक के तीन ब्रांचेस होते हैं बेटा, लेफ्ट gastric artery, splenic artery और common hepatic artery. Now common hepatic artery will divide into two parts. The common hepatic artery will again divide into two parts, okay. One will go towards the liver, okay, and one will go towards the duodenum part, okay. I'll just draw it a bit nicer, and one will just go towards the duodenum, okay. So this branch over here, it is called as the hepatic artery proper, is going towards the liver. Hepatic artery proper, and this branch that I have drawn right now, it will be called as the gastroduodenal artery. Gastroduodenal artery. The gastroduodenal artery. Now, the gastroduodenal artery will pass behind the duodenum, I mean behind the junction of the stomach and the duodenum, okay, and that's why I'm drawing it a little dotted, guys. Remember, I'm drawing it dotted. This gastroduodenal artery will give, it is passing behind this junction, it is passing behind this junction, and yeah, this will be giving one branch, okay, this will be giving one branch, okay, and it will be anastomosing with the left gastroepiploic artery. It is giving one branch, and this is the right gastroepiploic artery. This is the right gastroepiploic artery. इज द राइट गैस्ट्रोएपिप्लोइक आर्टरी, ऊपर लेफ्ट थी, और ये दोनों अनास्टमोस कर रहे हैं, आपस में मिल रहे हैं, ठीक है। और एक ब्रांच जो है, वन ब्रांच मोर, it will give, okay, it will give towards the pancreas, okay, it will give towards the pancreas, okay. So it is called as, and it will divide into two parts, one going in front and one going behind. So remember that this branch is called as the superior pancreatico duodenal artery. So the gastroduodenal artery is getting divided into superior pancreaticoduodenal artery and right gastroepiploic artery. Right gastroepiploic artery. And remember, it is further giving off two branches, guys. It is further giving off two branches. This branch, it is termed as the anterior. It is one, it is coming in front of the pancreas, one it is going behind. Over here, beta, over here. Okay, I just forget to draw it. Just remember that over here we have something which is called as the pancreas. Okay, which is called as the pancreas, right? And this pancreas is passing behind the stomach. And this pancreas is passing behind the stomach. Now, this is something which is called as the pancreas. Okay, this is the pancreas. पेनक्रियास बेसिकली लाइज इन द आर्म्स ऑफ द ड्यूडनम, तभी हम लोग उसको रोमांस ऑफ ड्यूडनम बोलते हैं, है ना। तो हमारी बॉडी में ही रोमांस चल रहा होता है ना पेनक्रियास और ड्यूडनम के बीच में, तो इसको हम लोग रोमांस ऑफ ड्यूडनम भी बोलते हैं। पेनक्रियास लाइज इन द आर्म्स ऑफ द ड्यूडनम, दैट्स व्हाई इट इज कॉल्ड एज द romance of duodenum. So this is the pancreas. So you can see that we have the superior pancreaticoduodenal artery, which is dividing into two branches. One it is supplying the anterior part of the pancreas, one it is supplying the posterior part. So it is the anterior branch of superior pancreaticoduodenal artery, and the dotted one, it is beta inferior, I mean posterior, it is posterior branch of superior pancreaticoduodenal artery. Posterior branch of superior pancreaticoduodenal artery. Okay, so remember कि celiac trunk से एक branch निकली, that is the common hepatic artery. It divides into hepatic artery proper and gastroduodenal artery. Gastroduodenal artery passes behind the duodenum, okay, and it divides into two parts, superior pancreaticoduodenal artery and right gastroepiploic artery. और superior pancreatico की भी दो branches, एक anterior part of the pancreas जो है उसको सप्लाई करेगा, और एक posterior part of the pancreas, especially the neck region and the head region. head यहीं पे होता है ना, ये पूरा बॉडी हो गया ऊपर की तरफ, और ये लास्ट में मैंने टेल बनाया है, ठीक है। तो इट इज जस्ट लाइंग इन द आर्म्स ऑफ द duodenum, commonly called as the romance of the duodenum, right? So uh, apart from that, guys, you have to remember one more thing over here, that this gastroduodenal artery, it is giving one branch which is supplying the superior part of the duodenum. Now this is called as the superior, or no, it is called as the supra duodenal artery. ये भी आप लोगों को याद रखना है. I'm just writing it over here so that you remember. Supra duodenal artery. Supra duodenal artery. Now, if I ask you supraduodenal artery is a branch of gastroduodenal artery. Gastroduodenal artery is पीछे से जाकर ये दो में bifurcate होती है. Okay, one it is supplying the greater curvature, that is the right gastroepiploic artery, and one is the superior pancreaticoduodenal artery. Apart from that, it is supplying the pancreas and the stomach. It is also supplying the first part of the duodenum, and that is too by the name of supraduodenal artery that you guys can't forget, and it is directly coming from the gastroduodenal artery. It is directly coming from the gastroduodenal artery, right? So apart from that, guys, you also have to remember, okay, let's this hepatic artery which I have drawn right now, guys, this hepatic artery which I have drawn right now, this hepatic artery will divide into this hepatic artery will divide into the right hepatic artery, and it will go towards the and it will divide into the left hepatic artery. So we have the left hepatic artery, and we have something which is called as the right hepatic artery. It is divided into two. The hepatic artery proper. The hepatic artery proper is dividing into the left hepatic artery and the right hepatic artery. The right hepatic artery. So this hepatic artery, the right hepatic artery, especially is giving a branch. Especially it is giving a branch to the gallbladder. This is the gallbladder. Gallbladder. And it is giving a branch to the gallbladder, and that is called as the cystic artery. This is called as the cystic artery. Cystic artery. So guys, remember one thing. Now, every time when I'm teaching any arterial supply to any part of the gut, I mean any like upper limb also, lower limb also, I'm always telling you to go to the left ventricle. Now, if I ask you, cystic artery is a branch of right hepatic artery. Right hepatic artery is a branch of hepatic artery proper. Hepatic artery proper is a branch of common hepatic artery. Common hepatic artery is arising from the celiac trunk. Celiac trunk arising from the abdominal aorta, the ventral branch of the abdominal aorta. Abdominal aorta is continuation of thoracic aorta. It is continuation of the arch of aorta, and it is just going to the left ventricle. Every time try to reach the left ventricle whenever we are discussing any artery, because many of the times in exams also we will be just focusing on one particular point, that this particular artery is a branch of, and most of the students like don't know this. And that's the reason, guys, I always ask my students to always go and learn the arteries in a retrograde manner, okay. So every time reach the left ventricle. Now suppose let us take one more example over here. If I just want to say posterior branch of superior pancreaticoduodenal artery is a branch of superior pancreaticoduodenal artery. It is a branch of gastroduodenal artery, common hepatic artery, celiac trunk, abdominal aorta, thoracic, no, arch of aorta, okay? And then to the left ventricle, So that is something you have to keep in mind. Apart from that, guys, one more thing that I just forgot over here. There are some branches from the splenic artery which are supplying the pancreas. Okay, there are three branches mainly. There are three branches which are coming from the splenic artery, and they are supplying the pancreas, that I'm just naming them as 1, 2, and 3. And I will be just writing it over here. What does 1, 2, or 3 stands for? Over here, I'm just writing, and these are the branches which are directly coming from the splenic artery. And this one basically stands for the dorsal pancreatic arteries. These are supplying the body and the tail of the pancreas. The dorsal pancreatic artery, the dorsal pancreatic artery. The second one, it is the arteria pancreatica magna. Arteria pancreatica magna. Magna means large one. So remember, it is the largest branch of the like pancreas, means the largest artery which is supplying to the pancreas. Out of all the three, it is the arteria pancreatica magna. Okay, and the third one that I have just mentioned over here, yes, it is the arteria pancreatica, pancreatica chordae. Okay, the tail part of the pancreas. We have the tail of the pancreas. I will be discussing the organs in the next session, obviously. So remember that we have the three branches which are directly coming from the splenic artery. We have the dorsal pancreatic artery, arteria pancreatica magna, and arteria pancreatica chordae. Arteria pancreatica chordae. Apart from that, guys, one anastomosis is still left, which I wish to discuss it right now. Yeah, from the hepatic artery proper, from this hepatic artery proper, basically a branch from the hepatic artery proper will go to the lesser curvature of the stomach, and with anastomose with the left gastric artery. And this branch that is coming from the hepatic artery proper, and that is something you guys have to remember because it is somewhat this is the only part that guys you have to like remember, because it is not coming from the celiac trunk directly. It is coming from the common hepatic bifurcating into hepatic artery proper, and it is a branch of hepatic artery proper. And this branch, it is the right gastric artery. It is the right gastric artery, which ultimately actually anastomose with the left gastric artery. You can see the anastomosis also. I'm just highlighting the anastomosis. I mean between the right gastric artery and the left gastric artery. And over here we have the left gastroepiploic artery and the right gastroepiploic artery, right? And the three branches, the splenic, the common hepatic, and the left gastric. Okay, so this right gastric artery is a branch of hepatic artery proper. That is the only concept that you have to keep in mind. Right gastric artery, it is coming from the hepatic artery proper. Okay, hepatic artery proper. So yes, I hope this is clear up till now. I hope this is very much clear. The diagram which I have drawn right now, I hope it's almost clear. So we'll write some points regarding this. We'll just mention some points regarding this. So that is something I have made it very clear as of now. Okay. So yeah. So if I just let us just focus on the diagram that is given in the Gray's Anatomy, right? So you can just see the celiac trunk, right? So you can see the left gastric artery. Okay. You can see the left gastric artery. You can see the left gastric artery. Again, guys, I'm telling you, these images are very important for exam point of view. They can be asked directly. So this is the tortuous artery. Can you see the splenic artery just going behind the stomach, and it is branching into like several hilar branches, 5 to 7 hilar branches are there, and it is supplying the spleen, right? Even it is giving one branch that is called as the left gastro epiploic artery or the omental artery. Epiploic का मतलब ही omentum है ना, greater omentum, peritoneal folds की बात हो गई. ठीक है, so obviously you guys are very much now it is giving one more branch bit over here, that is the common hepatic artery that is dividing into hepatic artery proper and the gastroduodenal artery, right? Yeah, so you can just see over here as well. Okay, so yes, it is passing behind the duodenum. Can you see it is passing behind? I've just shown you. It is giving one branch that is called as the right gastroepiploic artery or right gastroomental artery. Okay, and so yes, you can easily see it over here. Okay, and pancreaticoduodenal artery, anterior and posterior division, anterior and posterior division. So that is about the image. Okay, now yeah, I hope the diagram is pretty clear to each and everyone. So just give me a thumbs up, those anyone who is watching the video, just let me know if it is clear to each one of you, right? That I can just continue with the other diagrams as well. Anyways, okay, perfect. Now the right gastric artery is a branch that is arising from the hepatic artery proper. Okay, hepatic artery proper. Tanupriya, very good. So only one attending the session. So okay, now so let us so you can just see the diagram which I have just shown you guys, right? So it is the hepatic artery proper, the common hepatic artery, Okay, the common hepatic artery proper, and the gastroduodenal artery. Can you see the common hepatic artery is dividing into hepatic artery proper and the gastroduodenal artery? And this hepatic artery is giving out the right and the left branch. The right hepatic artery, which is supplying the right lobe of the liver, and the left hepatic artery, which is supplying the left lobe of the liver. So yes, and right hepatic artery is giving one more branch. This branch you already know, it is the cystic artery, guys, which is actually supplying the gallbladder. It is the cystic artery which is supplying the gallbladder, right? Which is supplying the gallbladder. So let us understand or like write some respect to whatever we have just done. Short notes. Just I wanted to give you guys so that it's like piece of cake for you to know. Just mention 2 3 points regarding that. Yeah. So let us just focus on some important points. Remember that the left. So we are just focusing on the celiac trunk branches, celiac trunk branches. Okay. So remember that we have left gastric artery. I have turned the comment section off, guys. It's just via WhatsApp, or you can reply me. It's just via WhatsApp you can reply me. There's no other way out. So remember that the left gastric artery basically it supplies the lower end of the esophagus, plus it also supplies the lesser curvature of stomach. When I will be discussing the stomach, I will be focusing on the anatomical parts, the lesser curvature and the uh, greater curvature. Okay. Now remember that the pancreas is basically present behind the stomach. Okay, and pancreas is a retroperitoneal organ, right? So yes, if we just ask which is the largest artery of the stomach, these are all MCI questions, guys. Okay, these are all MCI questions. The largest artery of stomach. Now, when I say largest, beta, I'm just talking about the thickness over here. I'm just pointing out the thickness, and remember, it is the left gastric artery. It is the left gastric artery. So, in the diagram, also, if you are just drawing it, just draw it a little bit thicker. Just draw it a little bit thicker, also. Okay. Now, if I ask you another question, that what is the largest branch of celiac trunk? The largest branch of celiac trunk. Remember, the largest branch of celiac trunk, it is the splenic artery. It is the splenic artery. Okay, the largest branch of the celiac trunk, it is the splenic artery. We have three branches: the left gastric artery, okay, the splenic artery, and the common hepatic artery. Right. Next question: most common variation of cystic artery. Cystic artery. It is origin from hepatic artery proper. Hepatic artery proper. Now, guys, what does this statement means? I have already told you in the diagram that the cystic artery it is arising from the right hepatic artery. Sometimes most common variation you would be surprised that this artery is arising directly from hepatic artery proper also. So it is one of the variations which is seen. Um, Majority of the times it is the right hepatic artery, but the most common variation it can also arise from the hepatic artery proper as well. It can also arise from the hepatic artery proper as well. Okay. Remember one more question, that the gastric artery, the right gastric artery, most commonly, most commonly, it is a branch. It is a branch. I have just told you guys, it is a branch from hepatic artery proper. It is a branch from hepatic artery proper. It is a branch from hepatic artery proper. Okay. Okay. Even guys, two, three more questions that I wanted to discuss over here. That the first part of duodenum, it is more prone to ulceration. It is prone to ulceration. Ulcers होने के बहुत ज़्यादा chances होते हैं. Okay. Why? Because you already know over here the bile duct is opening. Okay, the bile duct is opening. Okay, here, and you already know if there is ulceration. Okay, if there is duodenal ulceration, which artery will be eroded first? You guys tell me. Duodenal ulceration, which artery will be eroded first? I have already told you in the diagram also that it is the duodenal artery, the gastroduodenal artery, right? The gastroduodenal artery. Okay, so yes, so it is the one which will be eroded first. The duodenal, in the duodenal ulceration, it can erode the gastroduodenal artery. Gastroduodenal artery. It can erode the gastroduodenal artery. Okay. And one more thing, that one branch that I have not shown over here, that is the retro. Retro मतलब बेटा क्या होता है? It's just behind. Okay. The retroduodenal branch, the retroduodenal branch of gastroduodenal artery. Okay. It is the main arterial supply to bile duct. It is the main arterial supply to bile duct. These are all viva questions which are very, very important on basis of celiac trunk. On basis of celiac trunk, these are like something very, very important, guys, that you all have to remember. I hope it's clear to each and everyone. I hope it's pretty clear to each and everyone. So I have just discussed the celiac trunk in, like, yeah. So yes, I hope I have discussed celiac trunk. Okay. Just give me a thumbs up, anyone who is watching the video right now. Yeah. Now I will be discussing the another branch that, guys, I already have discussed with you. That is the superior mesenteric artery. Okay, the superior mesenteric artery. Celiac trunk, I have already discussed you the foregut organs that are there. So I have already discussed. Yes. Okay, guys. Sumit and Tanu, very good. Now let us focus our discussion on superior mesenteric artery. The superior mesenteric artery. Now, before drawing the diagram for the superior mesenteric artery, so let us first try to enumerate the branches of the superior mesenteric artery. First, we will write and then I will draw for you guys. Okay, the branches of superior mesenteric artery. The branches of superior mesenteric artery. Now, guys, just let us look at the diagram which we have drawn earlier. So you guys already know we have something which is called as superior or pancreatico-duodenal artery. We have something which is called as the superior pancreatico-duodenal artery, which is coming from the celiac trunk anyhow. So obviously, guys, remember, if there is something called a superior pancreatico-duodenal artery, which is supplying the pancreas and the duodenum superiorly, I mean the upper part, So there will be something which will be called as the inferior pancreaticoduodenal artery. Okay, so there will be something which will be called as the inferior pancreaticoduodenal artery. Inferior pancreaticoduodenal artery. Okay, inferior pancreaticoduodenal artery. Now this is basically supplying. Okay, guys. Okay, now this is basically supplying. Now everyone knows that it is the artery of midgut. I've already told you celiac trunk जो है foregut, midgut को superior mesenteric artery और hindgut को inferior mesenteric artery supply करती है. So it is the artery of midgut. So you already know it will supply. It will supply the lower half of the duodenum. It will supply the lower half of duodenum. It will supply the lower half of duodenum. Okay, it will supply the jejunum, the ileum, the parts of the small intestine. Okay, ascending colon, ascending colon. Okay, and right one third of right one third of transverse colon. Right, one third of transverse colon. So basically it is the artery of the midgut and it is supplying the lower half of duodenum, jejunum, ileum, ascending colon and right one third of the transverse colon. So already we have discussed the branch for the duodenum. Now come to the next organ, that is the jejunum and ileum. So basically the arteries will be like supplying the jejunum and ileum. So these arteries will be commonly named as the jejunum and the ileal branches. The ileal branches, the jejunum and the ileal branches. Apart from that, guys, remember these are almost 20 branches. Almost 20 branches, guys. Okay. The third, remember we have the middle colic artery. I will draw a diagram, don't worry, guys. Middle colic artery. Remember that it is the main artery supplying transverse colon. It is the main artery supplying the transverse colon. Okay, then we have the right colic artery. Right colic artery. Okay, it is the main artery. It is the main artery supplying ascending colon. It is the main artery which is supplying the ascending colon. And at last we have ileocolic arteries. Okay, it will give rise to cecal branches, and we have appendicular branch also, which is supplying the appendix. Appendicular branch also. Okay, we have cecal branches. I will just write it over here if it is hidden, cecal, and we have appendicular branches, which I've just mentioned over here. So these two branches are coming from the ileocolic arteries. Ileocolic arteries. So these are all the branches that I will figure out in the picture that I will be drawing right now. Okay. So yes, I will be drawing the picture for the same thing, and then I will correlate it with the images which are given in the atlas. Okay, the cecal branches and the appendicular branches you just cannot see from there. It's like okay. So yes, now let us start with the diagram, guys. Let us start or focus on the diagram over here. So yes, we are discussing the superior mesenteric artery. SMA basically stands for the superior mesenteric artery. Okay, now guys, let us try to draw the colon first, the transverse colon and the ascending colon. I'll just draw a little bit over here so that I have more space for writing over there. Otherwise, it will be like hidden. Just drawing this little part that you guys are well aware. And from here, that is the terminal ileum which is coming out. So yes, we have the ascending colon, guys. Okay, we have ascending colon over here and the transverse colon. Okay, I just want to spoil my diagram. I'm just writing it over here. Transverse colon, and this is something that is the ascending colon. ऊपर की तरफ जा रहा है ascending colon and the transverse colon. Ascending colon and the transverse colon. Now you already know, guys. We are now going to start with the superior mesenteric artery. Now this artery which I have drawn right now, which are with the dotted point, it is the SMA, that is the superior mesenteric artery. Okay, it goes first in the front of the duodenum. Okay, it will go in front of the duodenum. Okay, I'm just drawing it more darker, and especially it will go in front of the third part of the duodenum. Now this is the duodenum. Okay, that is the third part of the duodenum. Third part of duodenum. Now this artery is going in front of the third part of duodenum. Now guys, you already know ड्यूडेनम जो है, अगर आपको नहीं भी पता है तो जस्ट रिमेंबर ड्यूडेनम एक रेट्रोपेरिटोनियल ऑर्गन है, ठीक है। अब रेट्रोपेरिटोनियल मतलब पीछे से, पीछे की तरफ है, तो आर्टरी उसको आगे से सप्लाई करेगी ना, तो आगे से ब्रांच जाएगी, तो दैट्स व्हाई सुपीरियर मेसेंट्रिक आर्टरी इज कमिंग इन फ्रंट ऑफ दिस ड्यूडेनम। ड्यूडेनम इज अ रेट्रोपेरिटोनियल ऑर्गन। बहुत बेसिक सा कंसेप्ट है, जो भी चीज रेट्रोपेरिटोनियल है उसको आर्टरी आगे से सप्लाई करेगी, और जो पेरिटोनियल है आगे उसको आर्टरी पीछे से सप्लाई करेगी। तो दैट्स व्हाई ट्रांसवर्स कोलॉन जो है, आपको पता होना चाहिए ट्रांसवर्स कोलॉन जो है, इट इज पेरिटोनियल। ओके, इट इज पेरिटोनियल। तो ऑब्वियसली this artery will pass, the superior mesenteric artery will pass behind the transverse colon. Why? Because it is retroperitoneal. Okay, transverse colon क्या है, retroperitoneal है। सॉरी, रेट्रोपेरिटोनियल लिख रहा हूँ, it is peritoneal। वेट, it is peritoneal। तभी तो वो पीछे से पास करेगी, पेरिटोनियल मतलब आगे हो गया, और आर्टरी सप्लाई करने के लिए उसको पीछे से जाना पड़ेगा उसके अंदर। ओके, तो इट इज पेरिटोनियल। बहुत बेसिक सा कंसेप्ट है बेटा, इसको हमेशा याद रखना कि जो भी ऑर्गन पेरिटोनियल है, जब मैं पेरिटोनियम कल आपको पढ़ाऊंगा तो आप लोग को मैं ये बताऊंगा कि जो भी पेरिटोनियम ऑर्गन्स होते हैं, ठीक है, उनको ब्लड सप्लाई पीछे से जा रहा है, और जो रेट्रोपेरिटोनियल जो पहले ही पीछे है तो उनको ब्लड सप्लाई आगे से जा रहा है, ठीक है। तो थर्ड पार्ट ऑफ ड्यूडेनम जो है वो रेट्रोपेरिटोनियल है, वो रेट्रोपेरिटोनियल है। दैट्स वाई जो सुपीरियर मेसेंट्रिक आर्टरी है उसके आगे से जा रही है, ठीक है। रेट्रो पीछे की तरफ हो गया तो उसको आगे से ब्लड सप्लाई जाएगा, रेट्रोपेरिटोनियल। बेसिक कंसेप्ट है, रटना नहीं है इसको, इसको जस्ट यू हैव टू अंडरस्टैंड इट विद मतलब कहते हैं ना, कंसेप्ट समझना है इसमें, ठीक है। तो नाउ गाइस, दिस सुपीरियर मेसेंट्रिक आर्टरी इट इज गोइंग लाइक दिस। जस्ट अ कनकेविटी बनाना तो ज्यादा सही रहेगा। नाउ दिस इज द सुपीरियर मेसेंट्रिक आर्टरी। देखना मैंने हल्का सा कनकेव बनाया है, ठीक है। दिस इज द सुपीरियर मेसेंट्रिक आर्टरी। तो ये मुझे लिखने की भी जरूरत नहीं है. इट इज द सुपीरियर मेसेंट्रिक आर्टरी विच इज कमिंग बिहाइंड द ट्रांसवर्स कोलन. ट्रांसवर्स कोलन के पीछे से आ रही है. ठीक है. नाउ दीज सुपीरियर मेसेंट्रिक आर्टरीज, ओके, पहला ब्रांच तो मैंने आप लोग को पहले ही बता दिया था, जो पेनक्रियास को ऊपर सप्लाई कर रहा है, तो वो ब्रांच तो हम यही बना देते हैं. इट इज सप्लाइंग द पेनक्रियास, और इट इज सप्लाइंग द पेनक्रियास. या तो ये पहली वाली ब्रांच हो जाएगी, दैट इज द इंफीरियर पेनक्रियाटिको duodenal artery. Inferior pancreatico duodenal artery. Inferior pancreatico duodenal artery. Inferior pancreatico duodenal artery. ओके, एक ब्रांच तो यही होगी सुपीरियर मेसेंट्रिक आर्टरी की, मैंने अभी बताया था. इंफीरियर पेनक्रियाटिको ड्यूडेनल आर्टरी, राइट. एक तो ये हो गई. अब दूसरी ब्रांच आ जाओ, दैट इज द जेजनम एंड इलियल ब्रांचेस. जेजनम एंड इलियल ब्रांचेस को सप्लाई करेगी. तो मैंने बताया था कि 20 है नंबर में, तो ये सुपीरियर मेसेंट्रिक आर्टरी से डायरेक्ट आ रहा है. So we have the jejunal and the ileal branches. These are 20 number, approximately 20 होती है number में. Okay? So we have which are supplying the jejunum and the ileum respectively. So we have the jejunal and the ileal branches. The ileal branches, the jejunal and the ileal branches. Right now, another branch that is coming from here. Okay, it is the middle colic artery. Okay, the middle colic artery. बेटा अब ये आर्टरी ना बिल्कुल अंदर मत बना देना ट्रांसवर्स कोलोन के. आई विल टेल यू द रीजन व्हाई आई हैव नॉट ड्रॉन इट, कि मतलब बिल्कुल अंदर तक नहीं बनाया मैंने इसको, क्योंकि ये बाद में और डिवाइड करती है. सो रिमेंबर दैट दिस इट इज द मीडियल मिडल colic artery, middle colic artery, and it is dividing further into two branches. Okay, it is dividing further into two branches. We have the left branch and the right branch. एक right की तरफ जा रही है, एक left की तरफ जा रही है. So middle colic artery is arising from the superior mesenteric artery and it is dividing into the right branch as well as the left branch, right? It is like this, okay? Now after dividing, these arteries are giving numerous branches to the transverse colon like this, direct numerous branches. Now these small arteries which are arising from the right and left branch, these are called as arcuate arteries. These are called as arcuate arteries. Arcuate arteries. Now we have the middle colic artery, jejunal ileal branches or inferior pancreatico. अब एक branch और पढ़नी है. That is the right colic artery. Okay, we have something which is called as the right colic artery. Now this right colic artery is again dividing into the upper branch. एक ऊपर की तरफ जा रहा है और एक आ जाएगा नीचे की तरफ, the lower branch. Okay, and again this right colic artery, okay, I'll just write it over here. This is the right colic artery. Right colic artery, it is dividing into the upper branch and the lower branch. The right colic artery is dividing into the upper branch and the lower branch, and it is giving numerous branches over here. It is giving the numerous branches to the ascending colon in the form of arcuate artery. It is giving numerous branches over here, these straight branches. This is which is called as the arcuate arteries. These are the arcuate arteries. अब ऑब्वियस सी बात है ना, ये बाद में आके क्यों इस तरह से डिवाइड करी, ताकि हर एक पार्ट को ब्लड सप्लाई मिल सके। अगर ये स्ट्रेट जाती तो सिर्फ एक स्मॉल पार्ट को ही सप्लाई कर पाती। इट इज फर्दर डिवाइडिंग इनटू मेनी स्मॉल स्मॉल ब्रांचेस गाइस। द ओनली रीजन इज दैट just to have a clear picture for this, right? I mean, to have a proper blood supply to every part of the clot, right? So yeah, these are the arcuate arteries. Now one more artery which is coming, I'll just draw it with a different pen. Okay, one more artery which is coming, it is called as the ileocholic artery. Okay? It's called as the ileocholic artery. So I'm just writing it over here, ileocholic artery, ileocholic artery. Now this ileocholic artery, it is basically dividing into, okay, it is going up also. This ileocholic artery is anastomosing with, now the right cholic is divided into the upper branch and the lower branch. So ileocholic is basically going up and anastomosing with the lower branch of the right cholic artery. और एक ब्रांच जो है वो जाकर anastomose करती है superior mesenteric artery से. Okay, that is the lower branch of ileocholic artery. This is the lower branch. And remember, the lower branch is anastomosing, ये खुद anastomose, ये खुद जाकर मिल जाती है इससे superior mesenteric artery से. It is anastomosing, or it anastomose with its own superior mesenteric artery terminal branch. जहाँ पे ये खत्म हो रही है सुपीरियर मेसेंट्रिक आर्टरी, उससे जाकर ये अनास्टमोस कर जाती है। तो अनास्टमोसिंग साइट्स तो आप लोग को पता चल गया कि सुपीरियर मेसेंट्रिक आर्टरी के साथ कौन अनास्टमोस करा है, इलियोकोलिक आर्टरी ही है। और उसकी कौन सी ब्रांच है, नीचे की तरफ लोअर ब्रांच हो गई इलियोकोलिक आर्टरी की। अपर ब्रांच अनास्टमोस कर रहा है लोअर ब्रांच ऑफ राइट कोलिक आर्टरी के साथ, और मिडिल कोलिक आर्टरी का लेफ्ट ब्रांच जो है वो अनास्टमोस कर रहा है अपर ब्रांच ऑफ राइट कोलिक आर्टरी। तो ये 3 पॉइंट्स तो अनास्टमोसिस के मैंने आपको यहीं पे दिखा दिए। नाउ meanwhile meanwhile it is going like this. Remember that this lower branch, the ileocholic artery, okay, it is giving blood supply to the cecum as well. Okay, one in the front and one at the back, and this is something which is referred as the cecal branches. The cecal branches, it is something which is referred as the cecal branches. The cecal branches, okay. And one artery, okay, that is the end artery which is coming behind the terminal ileum. Okay, it is going and supplying the appendix, and it is called as the appendicular artery. It is called as the appendicular artery. Appendicular artery. And remember, it is an end artery beta. It is an end artery, means ये आर्टरी किसी के साथ एनास्टमोस नहीं करती, ठीक है। एंड आर्टरी का मतलब होता है इट डज नॉट एनास्टमोस, it does not anastomose. And remember that this is the terminal ileum that I have drawn. Terminal ileum that I have drawn. So I hope this picture is very much clear to everyone. The appendicular artery, the cecal branches are directly coming from the ileocholic arteries, right? Ileocholic artery की lower branch खुद ही anastomose कर रही है superior mesenteric artery. Right cholic ऊपर और नीचे, upper branch lower branch में, middle cholic artery right branch और left branch में खुद ही divide कर रहा है, ठीक है। So that is something that you guys have to like stay focused on. Stay focused on, okay. चलो इसको एक टेबल में, क्योंकि ये डायग्राम अब हम लोगों ने समझ लिया है, तो इसको एक टेबल में हम लोग एक बहुत शॉर्ट से टेबल में इसको पूरा मतलब समराइज कर देता हूँ कि कौन सा ब्रांच कौन से एरिया को सप्लाई कर रहा है। तो एक डायग्राम ये और इसका एक पार्ट जो मैं आप लोगों के लिए अभी बनाऊंगा। चलो बिफोर कमिंग टू द डायग्राम, जस्ट लेट मी जस्ट add one more slide and write it for you guys, so that you the concepts are very much clear as of it will be like more clear to you people once I just add one more slide to the concepts. Okay, So remember guys, let us first write down the branch. We are discussing the superior mesenteric artery, the superior mesenteric artery, the superior mesenteric artery, and remember that it is SMA, superior mesenteric artery. And yeah, I will be discussing the branch, and remember the area of midgut supplied. It will be a small table but very useful. Area of midgut supplied. Area of midgut supplied. So remember that the first branch, it is inferior pancreatico duodenal artery. Duodenal artery. It is supplying the lower half of the duodenum. Lower half of duodenum. ओके, प्लस मैंने बताया था नीचे की तरफ क्या होता है, हेड होता है पेनक्रियास का, ठीक है, प्लस द हेड ऑफ द पेनक्रियास, प्लस द हेड ऑफ द पेनक्रियास. The second one, guys, remember we have the jejunal and the ileal arteries. I don't have to even tell you, it is the jejunum plus ileum, okay, except the terminal part of the ileum that I have not shown right now, like supply, except terminal part, terminal part, okay. The third, we have discussed the ileocholic arteries, ileocholic arteries, okay. Ileocholic arteries, okay. It is supplying the cecum plus terminal part of ileum. अब टर्मिनल पार्ट ऑफ इलियम को जेजनल और इलियल नहीं करती, कौन करता है, इलियोकोलिक आर्टरीज, ठीक है, ये जो पॉइंट है ये आप लोगों को ध्यान रखना है, ओके. टर्मिनल पार्ट ऑफ इलियम, सीकम, अपेंडिक्स एंड, खुद दिमाग लगाओ, जो दिख रहा है वही बोलना है, और थोड़ा सा पार्ट ये असेंडिंग कोलॉन का, लोअर वन थर्ड ऑफ असेंडिंग कोलॉन, जो पिक्चर में है वही मैं कॉपी कर रहा हूँ, लोअर वन थर्ड ऑफ ascending colon, lower one third of ascending colon. Then we have something which is called as the right colic artery, right colic artery, and remember it supplies the upper two third of ascending colon. अभी मैंने बताया ही था, देखो, right colic artery अपर टू थर्ड ऑफ असेंडिंग कोलॉन सप्लाई कर रहा है, ठीक है, असेंडिंग कोलॉन के हिसाब से देखो, असेंडिंग कोलॉन, ओके, प्लस राइट कोलिक फ्लेक्शन. ये जो टर्न आप लोगों को दिख रहा है ना, दिस टर्न, it is also being supplied by this hole, okay. Apart from that, remember we have the middle colic artery, middle colic artery, and remember it supplies the proximal. When I say proximal, it means the right two third of transverse colon, transverse colon. अब फॉर एग्जांपल ये पूरा ट्रांसवर्स कॉलोन नहीं बना, मैंने सिर्फ दो तिहाई हिस्सा ये ट्रांसवर्स कॉलोन का जो सप्लाई कर रही है, ओनली टू थर्ड पार्ट ऑफ ट्रांसवर्स कॉलोन, वन थर्ड तो अभी हम देखेंगे इंफीरियर मेसेंट्रिक आर्टरी में, ठीक है. तो ये जो डायग्राम में बनाया था उसी को मैंने बस पॉइंट्स में यहाँ रेप्लिकेट किया इसमें. आई होप दिस इज क्लियर टू ईच एंड एवरीवन. Apart from that, guys, if we just focus on this particular image, so you guys can even see that we have something which is coming, that is the middle colic artery, okay. Middle colic, right colic, और फिर इलियोकोलिक आर्टरीज भी है, ठीक है, the ileocholic arteries. और ये जो ब्रांचेस निकल रही है 20-30 ब्रांचेस जो ये निकल रही हैं, आई हैव ऑलरेडी टोल्ड यू दीज आर जेजनल आर्टरीज, राइट? These are jejunal arteries and we have iliac arteries as well. Jejunum and iliac arteries, ऊपर वाला पार्ट जेजुनम हो गया और नीचे इलियम हो गया। तो देखो 15-20 ब्रांचेस डायरेक्टली निकल रही हैं। एटलस की इमेज है, अपेंडिक्स को सप्लाई कर रही है, अपेंडिकुलर आर्टरी आ गई। और टर्मिनल इलियम को भी कौन सी सप्लाई कर रही है? इलियोकोलिक आर्टरीज। जेजुनम और इलियम नहीं है। जेजुनम इलियम सिर्फ जेजुनम और इलियम को पूरा सप्लाई करती है एक्सेप्ट द टर्मिनल पार्ट ऑफ इलियम व्हिच इज सप्लाइड बाय द इलियोकोलिक आर्टरीज, राइट? तो और सीकम वाली आर्टरीज भी सीकल आर्टरीज हो गई, ठीक है? तो ये डायग्राम आप लोग को, और ये राइट फ्लेक्सर को भी सप्लाई करे। इसी डायग्राम को मैंने रेप्लिकेट किया था जो आप लोगों ने अभी देखा है, सुपीरियर मेसेंट्रिक आर्टरी, द सुपीरियर मेसेंट्रिक आर्टरी। आई होप इट इज क्लियर टू ईच वन ऑफ यू. So yes, you can very well see in this diagram also the same diagram. It's just a bigger view. Just give me a thumbs up anyone who is listening the lecture. I hope it's pretty clear to each and everyone, those who are listening me out there, right? So yes. Sure. Anyway, now I will be focusing my discussion on the inferior mesenteric artery. Just waiting for anyone to just reply it out. If anyone is listening, yeah, it's Sumit. Okay. Perfect. So I have discussed the two arteries in detail, guys. The superior mesenteric artery and the celiac trunk. Now I will be focusing my discussion on the inferior mesenteric artery. Okay, the inferior mesenteric artery. Yes, Tanu, very good, beta. So we have discussed celiac trunk and the superior mesenteric artery. Now I will be discussing about the inferior mesenteric artery in detail with a very short diagram. And yeah, superior mesenteric artery done. All the images I will share with you on my Telegram group. All the images I will like share. Inferior mesenteric artery. Now, firstly, if we just focus on the branches, guys, if I just focus on the branches, yeah, if I just focus on the branches of, okay, first, okay, let us see what it supplies to. Okay, let us first see what it supplies to. Okay, remember that it is the artery of hindgut. Artery of hindgut, it simply means that it will supply. अब क्या क्या बच गया था बेटा, खुद को ही पता है तुम्हें. It is lower one third of, oh sorry, lower लिख रहा हूँ, left, right टू थर्ड तो वहां सप्लाई हो गया था ना. तो अब क्या बचा, लेफ्ट वन थर्ड ऑफ द ट्रांसवर्स कोलॉन. Left one third of the transverse colon. You can very well see over here transverse colon. Okay. Apart from that, अब ट्रांसवर्स कोलॉन के नीचे क्या आ जाएगी, डिसेंडिंग कोलॉन. डिसेंडिंग कोलॉन और फिर आ जाता है सिग्मोइड और फिर आ जाता है रेक्टम. So we have sigmoid colon and along with that we have the rectum. We have the rectum. So it supplies the left one third of the transverse colon, descending colon, sigmoid colon and the rectum जो पार्ट रह गया था. ठीक है. तो इसकी पहले ब्रांचेस को एक बार थोड़ा सा डिटेल में देख लेते हैं, मतलब पहले ब्रांचेस के नाम लिख लेते हैं और फिर डायग्राम तो बना ही लेंगे, कोई दिक्कत वाली बात नहीं है. तो ब्रांचेस में आप लोग को पहला याद रखना है, वी हैव समथिंग व्हिच इज कॉल्ड एज द लेफ्ट colic artery. The left colic artery, and remember it is the main artery which is supplying the descending colon. Okay, the left colic artery. Okay, we have secondly the sigmoidal arteries. The sigmoidal arteries which is supplying the sigmoid. Okay, the sigmoid colon, and numerally basically they are 3 to 4 in number and they are supplying the sigmoid colon. Sigmoid colon. And the third one, beta, remember we have the superior rectal artery. The superior rectal artery. And okay, now superior rectal artery, basically it is a continuation of it is supplying the rectum only. Okay, अब ये it is actually continuation of the inferior mesenteric artery na, and it is just supplying the upper part of the what we say the rectum. Okay, that's why it is superior rectal artery. It is continuation of inferior mesenteric artery only, and it is just supplying the upper part of the rectum. So let us just now try to focus our discussion on this inferior mesenteric artery, and we'll try to draw a very I would say a very easy diagram now for this, because already we have discussed it. So yeah, this is somehow very easy. Inferior mesenteric artery, that is IMA, inferior mesenteric artery. So I will be drawing that part only which is required as of now. Okay. The left one third of the transverse colon, the descending colon. Hmm. So now guys, remember that this is the left one third of the transverse colon. Okay, this is the transverse colon. Just label the parts with me guys. This is the descending colon, descending colon, and yeah, we have the sigmoid part, and ultimately we have the rectal. We have the sigmoid colon, and the last, that is the rectum. That is the rectum. We just try to draw it guys. We'll draw it. So remember that we have something is called as the inferior mesenteric artery, right? This is, for example, we have this, that is the inferior mesenteric artery. Okay, the inferior mesenteric artery. Now one branch that is given. Okay, now again you will not draw these branches like hell. Okay, you will not like invade it into directly. Okay, so we have to just draw it. That is the left colic artery. Okay, so it is the left colic artery, which is further dividing into the above branch. Okay, upper branch, and it is dividing into the lower branch. And while dividing into the upper and the lower part, it is giving the numerous branches, so to supply the each part of the colon respectively. I mean, to ensure the proper blood supply, it is giving straight branches. Okay, it is giving the straight branches over here. Now apart from that, you all are aware that one more branch will be coming from here, from the inferior mesenteric artery, which are basically 2 to 3 in number, and these branches are the sigmoidal arteries. These are the sigmoidal arteries, right? One branch will anastomose with the lower branch of the left colic artery, and yeah, these are the sigmoidal arteries, guys. So this is the sigmoidal artery, guys. Sigmoidal artery. Yes, so we have the sigmoidal arteries over here. Apart from that, guys, remember that one branch, it is just a continuation of the inferior mesenteric artery, and this is the superior rectal artery. Superior rectal artery. The superior rectal artery. Yes, so these are the three branches that we have just discussed it over here. Okay, three inferior mesenteric branches. Yes, the supply already I have told you in the previous part only. So the left colic artery is supplying the left one third of the transverse colon, the descending colon, the sigmoidal artery supplies the sigmoid part, and the superior rectal artery supplies the superior part of the rectum. Right. So that is about the inferior mesenteric artery and the branches over here. Okay, guys. Now, apart from that, we already have discussed the inferior mesenteric artery. I just wanted to discuss some important points over here. I just wanted to discuss some important points. Um, yes. So that is based on the like the three arteries, the three diagrams, three branches, the supply that we have discussed right now. So based on these branches, let us focus our discussion on something value in, just to ensure. Hmm, yes. So I will be discussing something which is important. I mean, like clinical based application, guys. I wanted to discuss over here. I'm just drawing the colon like this: the ascending colon, the transverse colon, and the descending colon. Okay, and okay, let us just draw nicely. Let us just draw it. We have the ascending colon, the transverse colon, and the descending colon. Having my writing parts bit difficult. It is somehow the pictures look like this only. Okay, somehow the picture look like this only. So you already know. I'm just drawing a straight line to ensure that you guys already know that this is the ileopolic artery. Ileo सॉरी, हाँ इलियोपोलिक आर्टरी हो गई ये, ठीक है। उसके ऊपर क्या आ जाती है, राइट पोलिक आर्टरी, ठीक है। फिर आप लोगों को पता है कि ये एनास्टोमोस करते हैं आपस में ना, तो ये एक ही आर्टरी होती है ना, तो यस, राइट पोलिक आर्टरी। तो यहाँ पे मिडिल कोलिक आर्टरी हो गई, ठीक है। मिडिल कोलिक आर्टरी, फिर आ जाती है लेफ्ट कोलिक आर्टरी। अभी पूरी पिक्चर को मैं समराइज कर रहा हूँ, लेफ्ट कोलिक आर्टरी हो गई, ठीक है। और फिर ये नीचे चली जाती है तो सिग्मोइडल आर्टरी, और फिर नीचे आ जाती है तो रेक्टल आर्टरी हो जाती है। तो ये इस तरह का सब कुछ पिक्चर बनता है ना। अब इस पूरी आर्टरी को यहाँ पे, ये जो पूरी आर्टरी है, इस पूरी आर्टरी को हम लोग नाम देते हैं मार्जिनल आर्टरी ऑफ ड्रूमोंड। ओके, दिस combination of all the artery, like all this artery, actually it is called as, I'll just write it with black pen so that it's very much clear. Marginal artery of Drummond. Marginal artery of Drummond. ओके, मार्जिनल आर्टरी ऑफ ड्रूमोंड। अब एक क्वेश्चन यहाँ पे ये आता है कि जहाँ पे मिडिल कोलिक आर्टरी और लेफ्ट कोलिक आर्टरी की ब्रांचेस होती है ना, अपर ब्रांच ऑफ लेफ्ट कोलिक आर्टरी और मिडिल कोलिक आर्टरी की लेफ्ट ब्रांच जो है, वो जहाँ पे एनास्टमोस करते हैं, तो ये एनास्टमोसिंग साइट 5% पीपल में एब्सेंट होती है। इन 5% पीपल this anastomosis is absent. This anastomosis is absent. And remember, the middle colic artery and the left colic artery have direct connection. Okay? The middle colic artery and left colic artery have direct connection, और इसको हम लोग नाम देते हैं arc of Reolin. Arc of Reolin. Okay? It is the direct connection. It is the direct connection or the direct artery between middle colic artery and left colic artery. Middle colic artery and the left colic artery. Okay? आपको भी पता है लेफ्ट कोलिक आर्टरी क्या अपर ब्रांच देती है और लोअर ब्रांच, मिडिल कोलिक आर्टरी राइट और लेफ्ट ब्रांच देती है। तो मिडिल कोलिक आर्टरी की लेफ्ट साइड वाली ब्रांच और लेफ्ट कोलिक आर्टरी की ऊपर वाली ब्रांच आकर आपस में मिल रही है, दे आर कनेक्टिंग, but this anastomosis is absent. In that case, basically we have a direct connection with the middle colic artery and the right colic artery, that is over here, right? So remember that two more points that I wanted to discuss over here, that the right colic artery, the right colic artery most commonly then the middle colic artery is commonly absent artery of gut or GIT. Okay, now if अब खुद देखो, अगर ये आर्टरी एब्सेंट है, राइट कोलिक आर्टरी या मिडिल कोलिक आर्टरी, ये आर्टरीज एब्सेंट होती है मोस्टली, मोस्ट ऑफ द टाइम. इफ इट इज नॉट देयर, व्हाट विल हैपन, दिस इलियोसेकल आर्टरी will have an ascending branch. Okay, and middle colic artery will have a descending branch, so they will again anastomose with each other. If right colic artery is not there, agar beech se main right colic artery hata दूं, so ileocecal artery will now have the function, or it will extend up to it will give an ascending branch. Okay, and middle colic artery will give a descending branch. Okay, and the blood supply of the colon is not compromised. That's why it is the marginal artery of the Drummond. Basically it is an artery which is covering all the colon, even though if in many of the cases the right colic artery is absent. So the middle colic artery will give a descending branch, ileocolic will again give an ascending branch, so they will anastomose with each other and they will give straight branches, like we all discussed over there. The arcuate arteries will be there. Okay, they won't the blood supply won't be compromised in any part of the colon, in any part of the colon. So that is the function of the marginal artery of Drummond. Okay. Now there is a point over here, guys. There is a point over here that I wanted to discuss. Now this point, it is called as the Griffiths point. It is called as the Griffiths point, or it is present at the splenic flexure. It is present at splenic flexure. It is present at the splenic flexure, guys. It is present at the splenic flexure. And remember, guys, it is present at the splenic flexure, or I can simply say it is present between, it is present at the junction of midgut and hindgut. Midgut and hindgut. Okay. Now this point, the Griffiths point beta, it is vulnerable to ischemia. Vulnerable to ischemia. Now why it is vulnerable to ischemia? Ischemia का मतलब होता है बेटा low blood supply, means loss of oxygen, right? Loss of blood ही नहीं जाएगा तो ऑक्सीजन कहाँ से जाएगा? तो अब क्यों ऐसा होता है? क्योंकि 5% पीपल में जो एनास्टोमोसिस होती है ना, एमसी और एलसी के बीच में एब्सेंट होती है, तो ये जो पॉइंट होता है इसमें क्या कहते हैं, जो ब्लड सप्लाई है वो नहीं जाएगा। तो यहाँ पर अब क्या प्रेजेंट होता है? आर्क ऑफ रियोलिन दैट आई हैव ऑलरेडी डिस्कस्ड. सो द majority of the times it is not most vulnerable because it is compromised by the arc of reolin, that is the direct connection between the MCA and LCA. Okay, So that is like you have to be thorough with. Okay. And there is one more point that is present at the rectosigmoidal junction. Okay. The rectus and the sigmoidal junction, and this is the futex point. Futex point, it is present at rectosigmoidal junction. Rectosigmoidal junction. It is present at the rectosigmoidal junction. That is about all the arteries which are supplying to the gut. So in this video beta, I have discussed the arteries which are supplying to the gut. I hope I have made the things pretty clear to each and everyone over here, right? I have made the things pretty clear to each and everyone over here. So the inferior mesenteric artery we have discussed, the superior mesenteric artery, the inferior mesenteric artery. So inferior mesenteric artery run the superior mesenteric artery, the branch, and the celiac trunk, the abdominal aorta, how it continues, all the branches, all the images we also have seen it over here. So I hope the topic is clear to each and everyone, those who have watched it. Please, these are very, very important topics. The arterial supply of the gut, okay, the mid gut, hind gut, and the foregut. Everything I have like discussed it over in this video. The portal vein and the portocaval anastomosis I will be discussing in the next hour. Okay, so yeah, in the next case, so that is like you guys have to prepare this. Thank you, and thank you for your patience. I mean, for listening me out, guys. Yes, I'll be sharing the PPT with you people. Yeah, I'll be sharing the PPT with you people. So don't worry about it.